I got a call today from my buddy Jack Brown from Atlanta, and he told me that he has a man in his division, Earl Baum, who works with the CDC and has a good grasp on what's happening and what we need to know about it. So I'd like to introduce Mr. Earl Baum.
Thank you. Thank you. I'm going to hope that nothing I cover comes as a surprise to anybody. I think we've had enough news over the last little while that y'all have probably heard this multiple times from multiple sources. Also, I want to make note that I'm not on this as anything resembling an official rep from CDC. I'm just another jerk in the circle. I just happen to work there. I've been at CDC for 25 years, and everything that we do ultimately crosses my desk. So I don't know that I've got any different or better information than anyone else. I just probably have more of it, or at least more recent. And what I wanted to cover on this is just a couple of key points. What's real? That is, what do we know about the virus today? What we know, what we don't know. Why does it matter? What is this whole thing about flattening the curve, and why does it matter? And what can we reasonably expect over the next little while? And so I'm going to start by going back 102 years. The last time we had anything that even remotely resembled this was the 1918 flu pandemic. That pandemic, in one 6-month period in 1918, killed somewhere between 20 and 50 million people. We don't know exactly what that range is because some of the countries didn't have particularly good records, but somewhere north of 20 million, somewhere south of 50 million people worldwide. That pandemic, that particular version of flu, killed on average about 2% of those who were infected. The coronavirus, by comparison, depending on specific demographics, kills between 1 and 14% of those infected. So it's depending on demographic, between half as deadly up to 7 to 14 times as deadly as the 1918 flu. So it's real. This is something to be aware of. It kills the same way that flu does. It creates basically a viral pneumonia. Your lungs fill with fluid, you drown. The 1918 flu did that within a matter of hours. This one takes about 2 weeks. So that's good news and bad news. The good news is it takes up to 2 weeks. You've got more time to intervene, more time to treat. We've got better technology for treatment. We're still just treating the symptoms. The bad news is that in 1918, when someone caught the flu, you knew pretty much immediately that they were sick. With the coronavirus, it can be upwards of a week before anyone shows any symptoms. And in many cases, the symptoms are mild. And during that time, they're still contagious. Why does that matter? And this goes to some of the videos I've seen coming out of the beaches in Florida, South Padre Island, and in Texas. There's a demographic that figures if they don't get sick, why does it matter? Or if they get sick and they survive, again, why does it matter? The reason it matters is that one person who gets sick, even if they don't have severe symptoms, their symptoms are mild, even if all they have is a little bit of a fever and it goes away, they're still contagious. And you don't know that they're contagious for up to 2 weeks. That means that the teenager that's down on South Padre that gets exposed, 2 weeks later, they've potentially infected their parents, grandparents, your grandparents, your parents, the person down the street who's got a compromised immune system, their a coworker that's on chemo. That's why this matters. And that is why the measures that states, localities, businesses are taking feel so extreme. We don't know yet just how prevalent this is in the community. We know that the virus is out in the wild. It's no longer containable. It's in the community. So the working assumption at this point is that at some point, 100% of the population is going to be exposed. Let that sink in for a minute. At some point, within, between now and say a year from now, you're going to be exposed to this virus. What we don't know is what is the overall transmissibility of that. In other words, out of 100 people who are exposed to it, how many of them actually become infectious or become infected? And then of those, how many have severe symptoms? How many have potentially fatal symptoms? We don't know that relative number yet. We don't know whether out of that 100 people who are exposed, 20 people get sick, 5 people get sick, 100 people get sick. We don't know that ratio yet, and we won't know until we have much more thorough testing. So that's why that fairly extreme response matters, and why it's actually, I think, appropriate. Because we don't know yet, of those who are exposed, how many other people they're going to make ill, and what the impact's going to be. And I'm going to echo what Snow said. Everything he said was right on line. It will eventually come to an end. Live as though this is going to resolve, and it will. Even the worst of pandemics in history have had a defined beginning, midpoint, and end. 1918, the worst time was 6 months. The Black Death in the Middle Ages lasted about 18 months. It's going to end. Live as though it's going to end. Live as though you're going to pass through and come out the other side and recover. But in the meantime, things that you can expect to happen, what we're already seeing. You're going to see businesses shut down. You're going to see orders to shelter in place. You're going to see restrictions on movement. You're going to see restrictions on gatherings. You're going to see potentially disruptions to the supply chain. So what that means in practice, and again, Snow alluded to this, be prepared. Have food, have meds, have a plan for what happens if grocery stores have problems with distribution. Have a plan for what happens if the internet goes away. Chances are there's going to be at least some disruptions along those lines. Have a plan for those. Have a plan for what happens when this goes beyond 30 days. Everything I'm seeing at this point says that we're going to be dealing with some aspect of this for anywhere from 3 months to 6 months, depending on which case you're looking at. Somewhere in that window, 3 to 6 months is going to be how long some restrictions remain. So basically, this is a long haul. It's the idea here is we want to slow this thing down. We're not going to be able to stop it. It's too late to stop. Once it's in the community, the opportunities to contain it or quarantine it are really reduced. So all we can do is slow down the rate of exposure. So that's what I was alluding to as far as flattening the curve. The more we can slow the rate of exposure, the greater chance we have, one, to be able to treat it, the less stress it's going to put on the number of hospital beds we've got, the number of ICU units we've got, the number of respirators we've got. And right now, the number of respirators we have is less than 5% of the anticipated number of severe cases. Just as a kind of a wake-up call. We don't have enough respirators in the United States today to treat even 1 in 10 of those who present with severe symptoms. So we want to slow down that rate of presentation, slow down the rate at which people are exposed, so that when people do get exposed, when people do get sick, there's a hospital bed available for them. And the way we can do that is take a deep breath, hunker down, do all those unpleasant and inconvenient things that they're talking about: social distancing, work from home, Um, and I was listening to some men earlier. You've got businesses who are impacted by this. I really, really wish that I could give you better news. Unfortunately, I can't. The economic impact of this is going to be severe. It is severe. I've already seen businesses shutting down. I know people whose businesses are closing. They've got no customers. You know, they had to close their doors and they didn't have reserves. They had to let their staff go. They're closing their doors. They're going out of business. And I wish I had better news. Unfortunately, I don't. For at least the next couple of months, that's going to be the environment in which we live. And the only thing we can do, what to expect, is that we lean in together. We lean into each other. We do what we do for our families, our careers, our communities, the wider communities in which we live. We lean in, we support each other, and we help each other rebuild on the other side of this. So that's kind of a very long run-on sentence. Again, hopefully none of that is news to anybody. Just, yeah, I'm kind of sitting and living on this on a day-to-day basis, watching all the information crossing my desk. It's this is real. This is the worst thing we've faced in over 100 years, and the only way we're going to get through it is by doing what MDI does best. And that is living into a community, supporting our teams, supporting each other, finding ways to creatively engage with each other, engage with the communities, and be there to help rebuild on the other side of that. And with that, I'll shut the fuck up and take your questions.
Are we still using the raising hand function to do this?
Yeah, you can. That's fine. If anybody's got any questions, I want to let you men know that per our president, I'm going to be taking that section that, if it's okay with you, Baum, taking that section that you just gave us that advice and creating a audio recording of that we can send out to our members for those that weren't available on this call.
Sure.
Is that okay with you, Baum?
Caveat is that, you know, I'm not speaking as an official CDC representative. I just happen to work there.
And that will be part of the recording. I'll make sure that that's stated at the beginning so that it's clear, but it's still really, really, really valuable information. So my understanding, Estes, and you can just give me a thumbs up if I'm correct on that, is that anyone that's got a question I can ask, and I can have them, and Mr. Baum will answer them. So I'm going to go ahead and do that. Patrick Allard, I've got your hand up. Go ahead and ask Mr. Baum your question.
Hey, Mr. Baum, this is Allard here. First of all, thank you. Thank you so much for, you know, carrying the torch for this. There's a lot of people, at least in my community here in Alberta, that are late to the game. A lot of men looked at me funny at the last division meeting when I stopped hugging them. And I think it's a great thing that you've just done. I've got a question for you. There's a man that I know and that a few of the men here know as well, who works in ICU out in the West Coast. And he's connected with some ICU people in Seattle. And even as recently or as long ago as 5 days ago, the numbers of infected healthcare workers in Seattle were staggering, even before they started running out of protective gear. And I wanted to know if, number one, you knew about the elevated rate of infection and getting sick amongst the healthcare workers, and two, what significance it has that the men and women who are meant to be the most protected against this are the ones that are succumbing at an alarming rate. Complete.
Okay, the short answer is yes, that's true. That's a known circumstance. And the reason why it's happening is they are the ones who are most consistently exposed. Even in a very nearly sterile environment. Basically, unless you've got the equivalent of one of the CDC level 3 labs where nothing goes in that's not in complete biohazard suits, nothing comes out that isn't sterilized. Absent that kind of environment, you cannot completely prevent exposure. Coronavirus is spread through bodily fluids, through aerosols when you cough, through contact, and even in an ICU environment, we don't have the level of protection that is needed to completely prevent that transmission. In other words, healthcare professionals are going to be exposed at a higher rate than the general population. And of those exposed, even if there's only a 20% infection rate, if you're looking at 100% exposure over a matter of weeks, you're going to see that infection rate go up. So yes, we know it's a thing. No, we don't know of any way to contain that absent level 3 biohazard type of defenses, and we simply can't create that environment in every hospital, in every ICU, in every critical care ward that exists.
Thank you.
Did that answer the question?
Absolutely. Thanks.
Thank you for that question. Next, Mr. Bradford. Mr. Bradford, go ahead and ask Mr. Baum your question.
Mr. Baum, Bradford. So if 100% exposure is a likelihood, and I don't show symptoms, am I building up resistance or antibodies to this particular virus? And so can I get sick again in 6 months, or what's the body's reaction to building up resistance to it after exposure?
The short answer is yes. If you're exposed and don't get sick, you're going to have some degree of immunity going forward, similar to what you've got with the common cold with the flu. Those are common viruses that have broadly similar characteristics. The thing that I think sets this one a little bit apart is we've been living with flu for several thousands of years. We've been living with the rhinovirus, one that causes the common cold, for longer than that. So we don't have any native immunity to start from. In other words, if you've been exposed to flu in the past, even if there's a new strain of flu that comes out, you've got some immunity just because you faced a similar flu virus in the past. So we don't know how much immunity is going to derive from what level of exposure. That's one of the things that we're putting a lot of attention on research. We also don't know the mutation rate of the coronavirus. We know that there's already 2 strains out there that are infectious. We don't know how many more are going to branch off at what rate. So those are kind of the unknown unknowns that we're researching. We don't yet have an answer for. But the short answer is yes, exposure without illness does generate some degree of immune system protection. We just don't know how much.
Thank you.
Thank you for that, Mr. Bradford. Mr. Klee.
Hey, Bob, thank you very much for everything that you've brought us. I want to focus in on that eventual 100% exposure. I just want to make sure that that's absolutely clear, because it feels to me like that's when I watch our public health officials talk, that I haven't heard anybody say that.
Yeah, here's the working assumption. Once you've got a virus active in the community, there's no way that you can predictably contain it. And just like, over the course of a year, chances are you're going to be exposed to someone who's got a cold, someone who's got the flu. You're going to come across it either directly from being sneezed on, you're going to touch something that they've touched. This is similar to that. Over time, this virus is going to become as common as the common cold and the flu. What we're trying to do is to slow that down.
Could you
But yes,
describe for us what's going to happen when that gets into a senior's home?
it's already happened. That was one of the first outbreaks in the United States, was a seniors home in was it Washington State or Washington State, and they had it spreads like wildfire in that kind of environment. They didn't have isolation in place. They didn't have any kind of quarantine in place. It spread very rapidly. They had a number of infections and a pretty high rate of fatalities. You've got similar risks in prisons. You've got similar risks in the homeless population, where you've got a lot of close contact, no precautions being taken or limited precautions, and generally weakened populations. So once this thing gets into a community where you don't have the ability to isolate, you don't have the ability to maintain some kind of social distancing, and you've got a population that is already weakened. And I talked about the 14% fatality rate. Those are the communities I was talking about. Out of those who are exposed and become ill, you get a very high fatality rate in those environments. And all we can do at this point, all we know to do, is to put that off as long as possible in the hopes of getting, one, get those facilities better prepared so that they've got better disinfection protocols. They've got, the staff have better hygiene protocols. The residents have more time to prepare their environments so that you slow the spread, and also that gives us time to develop two things. One is a vaccine to prevent it, which is still potentially 12 to 18 months down the road, and two, targeted antivirals to treat it. At this point, we don't have anything to treat the virus infection itself except the natural immune response. All we can do today is treat the symptoms.
Okay, I appreciate your frankness, because I think I have, my mother and my brother are both, I may not have them in my life a year from now. Thank you very much for being honest.
Yeah, I don't want to sugarcoat anyone or anything. I don't want to overblow it either. Just it's what is.
Okay, thank you. I'm complete.
Thank you, Mr. Klee. I have a few more men and more men joining. Okay, great. Mr. Byrne or Byrne, I don't know if that's your first or last name.
It's Fitterer here. So yes, thank you.
So,
I do have a couple questions. I'll just focus on the questions and try and stay away from the story. Mr. Baum, earlier you said that there was a possibility, there's some demographics that are more susceptible. Are there other demographics that are less susceptible?
Sure. Broadly speaking, and you've seen some of this already, younger and healthier are less susceptible, older and sicker more so. Now, that's a gross oversimplification. The numbers that I'm seeing as of today is those are only sort of relative. Younger people at this point, the number of people under 60 who are being infected are roughly half of the total cases. So adults between 18 and 60 are half the cases we're seeing in the adult population. Adults over 60 are the other half. So you can look at that as kind of the midway point. The younger population tends to again, tends to present with milder symptoms. That said, that's not universal. About 20% of the most serious cases that are in hospitals right now are under 40. So, less susceptible in this case is only relatively less susceptible. It doesn't mean that they're immune. It doesn't mean that, just because they're 25, that they're going to get off, without a hitch.
Okay. All right. Thanks for answering that. The other one is, what is there a difference for being around other people indoors and outdoors? Greater transmission, is it less likely outdoors than indoors?
To a certain extent, the jury's still out on that. The transmission paths are more common indoors. You're going to have more of an opportunity to touch something that someone else has just touched. It is not as efficiently transmitted, say, outdoor on a windy day as indoors where droplets tend to hang out for a while. That's the thing to consider. So while the jury is still out, a crowded room with poor ventilation and lots of surfaces to touch is going to be more problematic than taking a walk through a park. If that makes sense.
Yep. Thank you. That answers my questions. Complete.
Thank you for that. We're going to take a few more questions here. We are running short on time. We want to respect men's time, so please keep it to one question per man and do your best to be respectful of the time. I have the Showinator. The Showinator. Go ahead and ask your
Love that
question.
name.
Thanks. So do we expect that this is going to get better if like by the end of August with maybe some vaccines and antivirals? And I have a situation where I have a girlfriend living in another house near me. Her son, he doesn't go anywhere, but we've been seeing each other, and I have a child that I share custody with. It's going back and forth between another town and my house on alternating weeks. What do I have to do? What can I do to, I mean, what should I do?
Short answer is, and it's going to sound trite, but it isn't. You do the best you can. To the extent that you are able, limit the exposure of all those people in the community. And one of the things I've seen, this came out in San Francisco, I've seen some other recommendations. If you functionally can't isolate within one household, and what it sounds like is you've got a couple households engaged here, isolate across those households. In other words, think of it as team quarantine, if you will, where okay, you're going to understand you're going to be exposing yourself and exposed to those in those other households, but limit it to the extent that you can to within that small group. I know some people that live on a cul-de-sac, and they are, their isolation space is the 4 houses at the end of the cul-de-sac. They've all said, okay, we're going to limit our contact to within this small community. And if that's the environment you've got, that's the environment you've got. You just want to be more aware that the larger number of people within a community like that, the larger the potential interactions outside of it. Someone still has to go shopping. Someone's still going to take a delivery. Someone's still going to answer the mail. So,
not quite as
Thank you.
simple as it would be if it's 1 or 2 people inside a single building, if that makes sense. As far as the timing on vaccines and antivirals, we know there's already 2 different vaccine trials that are either started or starting within the next day or so. Third one coming up on the horizon over the next couple of weeks. The normal time frame from the time a vaccine starts trials to the point where it's widely available is 12 to 18 months. I'm hoping that they can compress that a little bit. I think this has got enough attention, enough funding that they'll be able to do that. But it's not going to be something that happens in weeks or 3 to 6 months. I think 6 months might be potentially the earliest possible window for a vaccine, and that's pushing it. Antivirals, that has a better chance. There's companies already working on that. Same thing, there's a number of them that are ready to start trials. Those have a shorter time frame than vaccines, but still 6 to 12 months. Does that answer the question?
Yes, thank you.
Awesome. Again, we're short on time, so I want us to be real laser with our questions. Doug Samuel.
Yeah, hi. Thanks for all the information. My question is there a way of improving our immunity? Like, you know, having generally better health is obviously a plus. So it's like more vitamin C or anything like that. So when we're eventually exposed, we have a better chance of weathering the virus.
The short answer is yes. And it's the same sort of things that contribute to your ability to fight off a cold or the flu. The better your overall health. These are respiratory illnesses. Yeah, it's not a gut illness. It's not something that's a bleeding disorder. It hits the respiratory system. So anything you can do to improve your respiratory health. I hate to say it in this circumstance. I love a cigar myself. Smoking doesn't help. Vaping doesn't help. Specific risk factor that they've talked about beyond the normal, hypertension is one that is specifically identified as a risk factor. Weakened lungs, anything that contributes overall to a weakened immune system, those are the known risk factors. Vitamin C helps. Your basic antioxidants help. I don't want to go too far afield on those because I don't know specifics on that, but broadly speaking, anything that you can do to improve your overall level of health, boost your immune system, and reduce your vulnerability to things that target the respiratory system. And again, this is a community that enjoys cigars, but and I'm right there with you, but that's a known risk factor. Can't sugarcoat it.
Awesome. Thank you for that. Estes, I just want to check in with you. We're at 8:35, but we're going to just keep going. We got about 10 men, I would say. At this point, if you have not raised your hand, please don't, because we're running a little short on time. But I'll leave that to Mr. Estes. I'm here as long as you need me.
Well, obviously, men have a lot of questions. I think we can handle the questions that are already in. At some point, we're going to need to move on. Is Baum, are you available? I mean, that's a big imposition. There's a lot of men here, but would you be available to talk to any of these men offline?
Yes. I am still working. We're on 100% mandatory telework, but yes, I'm able to take questions and take phone calls.
You know what?
As long as it doesn't impact my ability to work.
What might be good is if we put together an impromptu Zoom, session just for this purpose. And I don't know, would you men be interested in something like that in the next week or so? Put your thumbs up if you think it's a good idea.
I think
All
it's
right.
a better use of Baum's time than having 15, 20, 30 men call him separately, because we can focus on it that way.
Yeah, for
He's
sure. Well, let's take
approves of
3
that.
more questions and then we'll schedule something in the next week, and we'll see if Baum's available to be on. How's that? All right.
That
Awesome.
works, and I'm very, very flexible.
Awesome.
Thank you,
We'll figure out the best scheduling for that. We're going to take, you said 3 more questions. Am I correct on that?
Yes.
Okay. So I'm going to bring up one of Stan Snow just brought this to me. One of the other best practices for Zoom. We know it's cute and all, but take the time to make your name correct in Zoom. Otherwise, you're going to hear what I'm about to say and go, oh, would Mr. Galaxy S8, or maybe it's Galaxy S8, I don't know, maybe it's like a license plate number. Whoever Galaxy S8 is, would you hop on? I don't know who you are or where you are. You may not know who you are either, but if you're on a Galaxy S8, there he is.
Yeah, I think it's Mark Pella. So I was looking for some further direction related to the social distancing. You know, you touched on it a little bit with the, you know, multiple family question, but like I've been having discussions with my own family and extended family and friends and sort of this conversation around, like, we just had our first reported person in our city yesterday, and there's been a sense of, you know, okay, we're going to be at home, but the kids can still do play dates, and, you know, we can still kind of visit our, you know, family and friends and that kind of thing. Can you be a little more prescriptive on, you know, what messaging to give people around this?
Yes, and you're not going to like it. The short answer is no. You can't do play dates. You can't do parties. Not unless you're willing to assume that those kids are going to come back having been exposed, that everyone who's at the party is going to be exposed. Social distancing is social distancing. It means specifically not doing those things. And yeah, I hate to be the bearer of bad tidings on that one, but you want to be as distant as you possibly can from every other human being to the extent that you can.
Okay, great. Thank you.
And you know, there's not a nice way to put that, but and you can't do it 100%, but to the extent possible, keep everyone as distant as you can from as many people as you can for as long as you can until this thing slows down.
Awesome. Thank you for that. Thank you for that answer. Mr. Jack Brown. You're muted. You got to unmute yourself.
So, Baum, does exposure mean you get it?
No. Now, the open question, and one that we're really struggling to identify, is we don't know how much exposure equals how many infections. So as I said earlier, the assumption is that at some point you're going to have 100% exposure. We don't know today whether those 100 people who are exposed, do 20 of them get sick? Do 5 of them get sick? Do 90 of them get sick? We don't have a hard number on that yet. And one of the reasons we don't have that number is we've not had really good penetration on testing. Even the best countries, as far as testing is concerned, like Singapore and South Korea, they've tested nowhere close to 100% of their population. In the United States, we've only tested out of 350 million people in the United States, we've only tested something south of 20,000 today. We're testing in the United States in total less than South Korea does in a couple of days. We don't yet know the answer to that. We don't know out of those 100 people, is it 10, is it 20, is it 50, is it 2? And we won't know until we get much further along on the ability to test.
Thank you.
Awesome. Thank you for that. Last question, Mr. Thibodeau.
Thank you. I wonder if I had missed this already, and there's a lot of talk about it in the media, but the paper masks, you know, how well do they work? If this is spread by, you know, you used a word, atomized breath, or like it's droplets, right? It's got to be actual moisture, and you would think that maybe not just those paper masks from the hospital, but even a heavier, like a dust mask you might use for drywalling, would that actually help from both exposing someone else if you have it or getting exposed?
It helps.
And I'm actually thinking specifically for like a quick interaction. I have this job to do, which is to move this king size mattress that takes 4 men. It's a fucking ravioli, weighs 150 pounds because it's gel. And it would take a half an hour to do. We wouldn't have to touch each other, wearing masks and rubber gloves that we take off right after.
So the short answer is yes, they help. They're not 100% effective because the masks don't cover your eyes. They don't cover everything that could come in contact, et cetera. But they do slow it down. They'll stop, you know, larger droplets. If you've got the gloves on, you know, don't touch your face with your gloves. That sort of thing that comes into play. And also consider one of the things I've seen a couple of times. People say, "I've got this mask and I wear it every day." It's a single-use item. You put it on, you wear it, you take it off, throw it away, because assume that it's contaminated, and if you touch it, you've just contaminated your hands. So yes, gloves work. Yes, masks work. Partially, no, not 100%, but partially, and they work if you take them off and dispose of them immediately. And don't put them back on again, because if you put them back on again, you're touching all of those things that those masks and gloves have been exposed to. So in your specific case where you've got a single interaction, mask and gloves, that'll help enormously. But don't take those same masks and gloves and use them the next day when you go shopping.
Makes perfect sense. Thank you.
Awesome. Gentlemen, as we said, we're going to schedule a follow-up with Mr. Baum at some point in the next week. Thank you all for your questions. I apologize that we were not able to get to 100%, but I think we did pretty well. Mr. Baum, thank you so much for your time and for really giving us all that information. It's unbelievably valuable.